Hello and welcome to a brand new Chairside Live. My name's Megan Strong.
And I'm Will Schmidt, RDA.
And we've cooked up a brand new format of Chairside Live.
That's right.
We've got more clinical content and it's going to be delivered in a fun and easily digestible way. So let's start digesting. Today we've got your first segment of Across the Chair. What do we got?
Today we're going to focus on opening what I like to call bold embrasures during interim dentistry using Biotimp's provisionals.
Great. And so speaking of provisionals, you're going to be talking about the importance of planning ahead during the provisional stage and creating the best environment for the area to recover?
That's right. And Megan, I'm glad to use that word provisional. I think that we're not just making temporaries here. We are seeking to place importance on interim dentistry. In fact, we are now starting the provisional revolution.
We are?
We are.
Okay.
Starting right now.
Okay, well then roll tape. Let's go.
No, I'm going to get right into this. What you see right here is the final product that I'm trying to accomplish. This is a completed 3-unit Biotimp bridge provisional, and I'm getting ready to seat it. Today we aren't really talking about the fabrication of the Biotimp in general, but instead I really want to focus on the finalizing of these embrasure areas. I don't like to think of any interim restoration as a temporary because we are always doing so much more than just covering a prep or trying to save the space. I really prefer to use the word provisional because we are setting up this treatment for success at the final stage way ahead of time. This is why opening the embrasure area and allowing the tissue a chance to properly rebound is one of the most important functions of interim dentistry. I recently presented a Biotimp's hands-on course to a mixed class of doctors and assistants using this very bridge and stone model combination. The main thing I witnessed is that most participants were very shy about really opening embrasure areas and left quite a bit of flash and a lot of bulk excess reline material in the way of the tissue. This really doesn't allow for proper breathing underneath these restorations. I started using the phrase bold embrasures, and I really think that's one of the key factors to success of this 3-unit bridge provisional. One really easy trick that I like to do just to start off with when dealing with provisionals that have Pontics is a small wrap of Teflon tape. Now, this not only keeps the Pontic area clean, but blocks out the deep embrasure areas so that none of the excess reline can get pushed into them. I'm going to try it back in here on the model, or back in the mouth, just to make sure that there aren't any hang-ups by adding an additional layer of this material. I think everything looks good here, so the Biotimp can be placed back into the fast dent, and this is going to help me with the correct path of insertion. I'll proceed from here right to the reline stage and either ask the patient to bite or simply just hold the Biotimp and stent in place myself. The Teflon can be removed during the gel state or even after the Biotimp has been removed from the preparations. I'm really not concerned today with showing the bulk excess removal of the reline, but instead I'm focused on the opening of the embrasure first with a high-speed handpiece. I really prefer this long, thin diamond burr, and I make very bold, very aggressive cuts into the embrasure, and I really open up the area where the tissue can breathe. From here, this same diamond burr can be used to round out and soften the area. I would really rather over-open embrasures versus under-open an embrasure. Now, this only took a couple minutes of preparation, but our outcome is a bold, open embrasure that's fairly optimal for tissue to bounce back. If the strength of this Biotimp is a concern, then a little pre-planning by ordering either a wire or Kevlar reinforcement is also an option. I understand that not everyone is going to use a high-speed handpiece chairside to trim provisionals, so I'm going to open up and finalize this second abutment from the lab bench. With my slow-speed handpiece, I really only need to utilize 4 burrs. First is a pointed carbide burr, which is great for the bulk takedown. A thinner diamond is used for refinement, and a Robinson wheel is great for the final polishing stage. But for our focus today, I'm going to use this double-sided diamond disc. I think one of the most common problems with these diamond discs is that they can easily warp and start to bend over time. My best advice to prevent this is to simply keep them in the container that they were delivered in. Of course, make sure that these are sterilized properly, but keep them protected afterwards. Moving quickly through the bulk removal of excess reline, let's take this diamond disc and boldly open this embrasure area. The disc doesn't necessarily need to be on a very high rotation speed. In fact, a slower speed is going to give you more control over the depth of this cut and will prevent that disc from jumping around and causing any mistakes. As a good practice, just when you think you've opened it up enough, I want you to go back in and refine just a little more. Follow it up with the diamond to trim and then smooth the area, and this Biotimp is ready for final polishing and eventually seating. The main lesson I want you to take away from today's focused explanation is the importance of planning ahead during the provisional stage and providing the best environment for the treated area to bounce back. Join me right back here on Chairside Live soon, where I revisit this case once more and talk about how Pontic design can add even more success to this BioTemp Bridges outcome. Thank you so much for watching. Take it away, Megan.
Thank you for that, Will. That was awesome.
No problem, Megan.
And so if people want to learn more about BioTemps, I know you've done some Chairside Live episodes in the past discussing tips and tricks. Where can they go to learn more?
Well, our viewers can visit glidewelldental.com, and while you're there, click on the Education tab and watch previous episodes of Chairside Lives, where I go into more detail about BioTemp's provisionals.
Awesome. Well, that about wraps it up for this first new format of Chairside Live, so thank you so much for watching.
And we'll meet you right back here next time.